do you take on a daily basis some sort of form of probiotic, or do you just eat a healthy diet?
I take a probiotic.
Fergus?
If I were taking an antibiotic, I would be taking a probiotic. If I were elderly and frail, I'm getting elderly, but I'm not totally frail yet, I would be taking a probiotic and prebiotics. If I were going into a developing country where the water supply was not very good, I would be taking a probiotic for sure. If I was putting myself into a situation at risk. Now, there are other people who need to take them, perhaps, patients who have illnesses that involve taking antibiotics or involve a reduction in diversity of their microbiota. I think they need to take them. A number of the chronic conditions we were talking about are those examples. I thankfully don't have those, so I feel I don't need to take it on a regular basis.
What do you think? Do you take anything on a daily basis?
So just a yogurt and a healthy diet.
That's routine yogurt, not a probiotic yogurt.
A probiotic yogurt.
Oh, okay. Good. You know, like Fergus, I'm getting a little older now, and I've watched the transition take place. I mean, 20 years ago, I was introduced to probiotics by Stig Bengmark. I'm sure you know Stig, a classic fella, one of the fathers of modern liver surgery, brought this concept to me, and I thought at first it was a little, but when I started reading what was available, it truly became, this is no question, this is the future. And for the first 10 years of my clinical life in the hospital, trying to get people to take these and get other physicians to give them, they thought I was truly crazy. That why would we ever want to give bacteria to people that are sick? We got to kill those bacteria and not give them more bacteria. But that has dramatically changed. As I mentioned this morning, our infectious disease doctors went from absolutely forbidding me to do probiotic protocols in the hospital, and then a year later, after hundreds of articles sending them showing the benefits, they finally said, okay, but stay away from the immunocompromised host. And they spent another year sending it to the transplant patient, maybe the very population needs it the most. And the only ones we cannot give it to in the hospital now are bone marrow suppressed immediately after the bone marrow transplant.
That's interesting.
We said, okay, we're not going to fight for those.